Your Pharmacy Career Podcast, proudly brought to you by Ravens Recruitment, Australia's pharmacy recruitment agency, spotlights the myriad of career paths available to pharmacists. Your host, Kristin Lee Patterson, and her esteemed guests will be sharing invaluable career advice that you can implement at any stage of your career journey.
Welcome to another episode of Your Pharmacy Career Podcast. I'm your host, Kristin Lee Patterson, and today we're joined by Kristin Xenos, a pharmacist with a rich background both in community and hospital pharmacy, as well as government organisations. Kristin is also the co-host of the Purple Pen podcast, a platform dedicated to enhancing clinical knowledge among healthcare professionals. Kristin, it is great to have you with us. How does it feel sitting in the guest chair for a change?
I was going to say it's a bit weird, but it's actually nice. Nice to kind of experience what the other guests we have on the podcast must experience when I'm chatting to them.
Excellent. Now, let's just dive straight in. Now, Kristin, your career has transitioned both from community pharmacy to significant roles in hospital pharmacy and even beyond that. So can you share with our listeners what sparked these changes and how you navigated these opportunities?
Yeah, definitely. I mean, my pharmacy career goes right back to when I was 14 years old and I worked in the front of shop in the local community pharmacy around the corner from my house. It was my second job ever. And I just loved it. I loved interacting with customers. I loved watching and learning from the pharmacist who I worked with at the time. And it was a very small pharmacy. And that really is what spiked my interest in pursuing pharmacy as a degree at Sydney Uni. And then from there, I moved into different placements within my pharmacy degree. And one of the placements was at a larger pharmacy, much larger than the one I was working at. And I was offered a job there, and kind of the rest is history in terms of working at Harper's Pharmacy in Earlwood, because I did my intern year there and continued on to be a pharmacist working there, but obviously not possible for Alex to keep every person he trains on as a full-time pharmacist ongoing. So that's kind of what prompted my interest to pursue hospital pharmacy, and that's where I kind of segued there. And in terms of how I got an interest in hospital pharmacy, that really came down to, I remember I was in first year pharmacy and we had a lecture series on all the different places a pharmacy degree take you. And there was one lecture given by Dr. Lisa Pont, who is a really excellent ambassador for the Society for Hospital Pharmacists Australia, SHPA. And she basically converted me. So listening to her talk about what it was like to work as a hospital pharmacist and engage with a multidisciplinary team on a daily basis really sounded right up my alley and kind of cemented my ambition at that point, that I thought at some point in my career I'd really love to experience what it's like to work in a hospital pharmacy environment. And after I finished my intern year, I thought kind of was a bit disheartened, because I thought to myself, it's going to be pretty impossible for me to get a position as a hospital pharmacist because I didn't do my intern year in hospital pharmacy. And that's usually quite a rate limiting step, because at the time there was a lot of interest in hospital pharmacy roles from pharmacists, and obviously, at some point, you've got to kind of cull the lists of candidates, and usually hospital pharmacy experience is one of the first criteria that people look at. So I was very lucky and thankful that I encountered a wonderful team at Sydney Eye Hospital, and that particular pharmacist, Celia Waite herself, had a background in community pharmacy. So I think wasn't as didn't have the same kind of fixation on a hospital pharmacy background, and gave me a shot. And I think that's the rest is history. I kind of had my foot in the door, and then once you've got hospital pharmacy experience, I think jumping between roles becomes a little bit more easy to navigate.
No, I definitely agree. It's interesting that you've had that thought about it being difficult to make that jump from community to hospital. And I'm sure there's plenty of other community pharmacists out there that are maybe thinking the same thing, or, I've been in community for a long time, it's just going to be too hard. I don't want to go down that route. But do you think being a community pharmacist, does that make you a better hospital
Oh,
pharmacist?
you took the words right out of my mouth, Christy Lee, because you have a different skill set as a community pharmacist from someone who's never experienced that environment. And I can tell you, some hospital pharmacists are plenty scared of community pharmacy because it's an intense environment. And I think one that not often a lot of people appreciate. I mean, you get a little bit of a taste of it in an outpatient pharmacy environment, but there's nothing like working in a community pharmacy with a limited team, a busy one at that, trying to offer a great kind of clinical service to your consumers, but you don't have the resources on tap to you like you do in hospital pharmacy. And the workflow and the work pace kind of, it comes at you whether you like it or not. And you have to manage that and manage consumers and prioritize and multitask. And all those skills are completely transferable to hospital pharmacy environment. And I think the other thing that you have a different perspective on and it is what it's like for patients when they leave the hospital. You know, I've been that pharmacist on a Saturday morning where a patient's been discharged from hospital, clutching discharge letters, random boxes of medications, not sure what to do next. So I think the way you work as a hospital pharmacist is informed by that perspective of, well, what's it going to be like for this patient to go into the community? What should I tell them? What resources should I give them? What additional support and contacts should I endeavour to do to make that transition from acute care back into primary and community care as smooth as possible for that patient? Because we know now transitions of care are really high risk environments for patients.
No, I totally agree. And I've definitely been that pharmacist on a Saturday morning or a Sunday afternoon. Yeah, I definitely feel there's always a bit of a influx of people being discharged prior to the weekend or just on the weekend before Monday starts. So definitely, yeah, have felt that. So I think that's a really interesting insight. But your career's also delved into some other avenues, which I thought was really interesting. And one of that's the World Health Organization. So I think maybe prior to COVID, some people probably thought the World Health Organization was, I don't know, just this thing that kind of worked in the background. People probably didn't really know what they did. But now post-COVID, I think everyone in the world has heard of the World Health Organization now. Yeah, how does someone get involved in the World Health Organization? You're a member of the FIDES network of healthcare influencers. That sounds quite interesting and fun. Yeah, can you explain what this involves and why it's important to you?
Yeah, definitely. So the name Fides, she was the Roman goddess of trust. So I think that's an important kind of detail to highlight there. And I think, as you say, Christy Lee, post-COVID, there has been an explosion exponentially of the kind of information that is available to consumers throughout the world and the discourse. And I think social media has a huge role to play in that as well. And it's excellent because it's democratized a lot of things to consumers and made that possible. But it's also meant that the checks and balances in terms of reviewing information, considering how it's going to be interpreted and acted upon by the end listeners isn't always necessarily there. And anyone has a voice on social media. And I think there are lots of perspectives on whether that's a good thing or a bad thing. But in the context of health information and education, I think it's important to note that a lot of the behaviors that people kind of engage in and the information they act upon have consequences not only for themselves, but for the people in the communities they live in as well. So I think that the aim of FIDES was to kind of bring together like-minded health clinicians who have public kind of personas in social media and podcasting and more broadly, and align a lot of the content in terms of what information's been provided and create an awareness globally as to who are the people that are offering good quality evidence-based information on a kind of public scale and support them to be able to do that better. So I think that's one of the great things about the FIDES network. And I have to give a shout out to one of the people that I'm connected with on social media, Jessica Cludas, who provides really excellent clinical content and she had posted about it and kind of sparked my interest, and that's where I went to from there, and how I kind of fell into working with that particular organization. And I think it's really important because I think as pharmacists, don't want to generalize, but a lot of the time we are very kind of a bit conservative and risk averse in terms of putting ourselves out there, and I don't understand the hesitation about doing that on an outward facing platform like a podcast or on a social media account, because there might be very valid limitations. For example, your workplace might have a media policy that you have to operate within, and that's completely valid and you understand why it's there. So the appetite for a pharmacist to put themselves out there in that particular context is going to be limited. But I think it's really important to balance the narrative and the resources available to people, because people are still going to look on social media for information and for advice and for education. So having really useful resources that are readily available to people that aren't necessarily behind a paywall is important.
Yeah, I totally agree. And you just maybe triggered me a little bit when you mentioned about organizations having social media policies and things like that. But yeah, you do have to be mindful of what you post and how you come across on social media, or even professional social media pages as well. And yeah, it can be a bit daunting putting yourself out there and understanding the reasons why those organizations might have those policies. And yeah, that's been a learning curve for me in my career over the years. And yeah, sometimes you make mistakes and you learn from them. And but then you're like, okay, well, how can I learn from this and how can I move forward and do it better for everyone? So yeah, I think that was a really great point that you made about that.
Well, because there are like lots of things to navigate as well, because we have a pharmacy board with a professional code of, conduct and ethical standards, which is important. And then you also want to be careful because there are very important guidances from things like the Therapeutic Goods Administration of advertising medicines. And you just want to make sure that you're always keeping those broader things in your mind so that you're not doing something that can be interpreted to be inappropriate.
Yeah, absolutely. I guess this is probably a really great time to jump in and start talking about the Purple Pen podcast. But first of all, I want to ask, why Purple Pen in the name? I think I know why, but I would like to get your feedback on that.
Look, the thing is, we're in too deep now. It's all the merch and the website. So, but going back to why, and we totally understand why the question comes, because back in my day, we had paper charts in hospitals and not electronic charts. So there's a whole cohort of pharmacists coming through now who would never have even touched a paper chart in a hospital. But back when we used to have paper charts, the pharmacist usually would annotate in a purple coloured pen. And that was most commonly in the state of Victoria, where the Purple Pen podcast has its origins with the amazing Jane Booth and Dan Guidoni, who created the Purple Pen podcast. But in New South Wales, hospital pharmacists use a green pen. In the ACT, sometimes they used a red pen. So that's the origins of the name Purple Pen podcast.
Interesting. Yes, I was sure that it had something to do with the types of pen you were using on the charts. But yeah, you're right. There are some pharmacists now coming through that have probably never seen that. So now that's...
And I'm someone who loves alliteration. So, I mean, it appeals to me on that sense as well.
Rolls off the tongue. Yeah, no, I like it. And it makes it think, what is this? I want to listen to it. So what actually inspired you to, become a co-host on a podcast?
Yeah. So my career evolved in hospital pharmacy, I went from the Sydney Eye Hospital covering a maternity leave contract. And I have to say, for someone looking to get into hospital pharmacy, really fortunate to have people going on breaks, whether that's for secondments or maternity leaves or extended trips overseas. It's an excellent opportunity just to do a short-term contract to gain that experience. And, one of the things that's good about hospital pharmacy is that people move around a little bit for, numerous reasons, and that can often create a foot in the door. So from Sydney Eye Hospital, I moved to Sutherland Hospital and then ended up at Westmead Hospital. and became more and more involved with the Society for Hospital Pharmacists from there, and involved in the New South Wales branch, and started attending medicines management scientific conferences, which were a really exciting space for someone who hadn't been to a professional scientific conference before. And it was a really wonderful environment of like-minded people sharing what they're doing in their workplaces in hospital pharmacy. And I found it really exciting, and I really enjoyed networking with the different pharmacists across different states. And it was there that I met Jane and Dan. And actually, they approached me after we met and became colleagues and then friends. And I think I was on their podcast as a guest initially when I was on the scientific committee for the MM 2017 conference that was in Sydney. So they were attending as podcast co-hosts and interviewed me about what it was like to be on the conference organising committee. And I think they probably had a bit of an agenda from that point on and thought it would be good to get another co-host, because there is quite a lot of work involved in running a podcast. And I think between the two of them, they were just finding the workload a bit difficult to manage, and probably also thinking about succession planning, about maybe if one day they didn't want to be involved as actively anymore, but still really thought it was a valuable contribution to have the podcast, could they hand it over to somebody they trusted and thought would continue the legacy of the podcast? So I was a bit hesitant at first and very nervous and wasn't sure about what it involved. So they said, come on and see how you like it. And I liked it. So just continued from there. And I flew over to Victoria, where they were both based at the time. And they gave me a one-day workshop on how to do podcast. So how do we record? How do we edit the content? How do we run the social media accounts? How do we find guests? And it was really from there that I kind of became more and more involved in the podcast. And it's something that I think I don't get paid for. So you have to be passionate about it and enjoy it. And I do. So that makes it easy for me to kind of, well, not easy, but easier to continue doing the work that I do for the podcast.
I was actually thinking of asking you what has kept you on the air for so many years now, which I think you kind of answered it with your passion there, because you're right. As someone who also does podcasting, it's there is a lot of work involved, and kudos to anyone that's producing and hosting podcasts. It's not easy. It's not just as simple as just jumping on a mic.
Exactly. And it's a tricky space to navigate, especially with sponsorship and perceived conflicts of interest. So it's something that we've been very mindful of, with sticking true to the ethos of the pharmacy podcast and wanting to just offer clinical content from a place of curiosity with a decent evidence base, so that people never felt that we were violating their ethical code about listening to us. And I think that we've had lots of interest over the years by various sponsors, and it's something that we just thought was easier to steer clear of, so that the space never really became muddied for us.
Yeah, good point. That's it's good that the Purple Pen podcast is sticking to the origins and the values of why you started in the first place, and that can be applied to any organization, I think, or anything that people do. So I really, really love that. Yeah, you're sticking true to those ethical values. It's very important. So I think that's also...
Well, it's like, what's the point of it? So I suppose the point of it is, when I worked in hospital pharmacy, especially in Westmead, we had a really excellent CPD program. So that's something that I enjoyed. Monthly, we would have one of the clinicians in the hospital, whether that was a doctor or an allied health professional, and pharmacists would rotate, taking turns about organising who would speak to us as a department about a topic of interest. And it was just something I really enjoyed keeping up to date with and learning about. And when I moved out of hospital pharmacy to work for the Australian Commission on Safety and Quality in Healthcare, it's something that I missed, was that real pharmacy clinical dedicated CPD, where it was just a particular topic of interest, whether that was a medicine or a disease state, and just getting an update about the basics of it and what's kind of emerging in the space. So I think when I moved out of that space, what really motivated me to keep going with the podcast was, well, I miss the CPD at my fingertips, so I can create that and ensure that one of the things that isn't as accessible to me in a current role, like, working for a government organization, is that clinical face-to-face with a patient. So the podcast kind of keeps me in touch with keeping up to date with clinical content, which is, I think, something really important as a practicing healthcare professional.
Absolutely. Do you know, or do you have any examples of how the podcast has impacted your listeners? It's the Popular Pen podcast, I believe, has been on air for over 5 years now, I think, maybe even longer.
It's going on 8 years, actually.
Wow, that's amazing. So, yeah, obviously people are listening to it, which is great. But, have you got any memorable feedback that stands out to you? Or
I mean, a couple of months ago, I think. So it's lovely if people leave stars on the various podcast apps. So it's, 4 stars, 5 stars, whatever. But I really, as you know, we don't get paid. So I take my little moments of gratitude when I read the words of people leaving reviews, whether that's on Apple Podcasts or wherever. And last month we got a review that was along the lines of, the podcast is easy to listen to, accessible, in-depth knowledge on relevant topics, and that they felt that it was a great resource, especially for people who have had breaks from the workforce and feeling their confidence wobble. And that was something that really resonated with me as someone who's had 2 periods of maternity leave. And whilst I've moved around my roles quite a lot, something that stayed constant is my casual shifts in community pharmacy. And I can tell you, stepping back into community pharmacy after 12 months off and picking up something, like I remember I came back from my first baby and I picked up a script and it was for Intuiv. And I was like, what the hell is Intuiv? I was like, got to pull out the AMH and have a look. A whole new medication had been come onto the market in the 12 months I'd been off, and I didn't even know the indication for it. But luckily I was able to create a podcast about it. So I said, you know what? If this is new for me, I bet you it's new for other people as well. So an episode on, the latest developments in ADHD medications was created. So it feels to me that anytime I encounter a topic, whether that's in community pharmacy, or my family often joke, if you have a look at the podcast history, they can see our family history of conditions kind of evolving, because as things unfold, a family member getting shingles, I was like, lots of questions, very valid questions that I had to look up the answers to that really wasn't at my fingertips. Let's create a podcast about it.
Oh, I love that. That's actually thinking, I need to go back and maybe listen to some of your older episodes and see if there's any relevant information in there for some of my family members' disease states as well.
It's nice to be able to share it with someone. And whilst we're a podcast that's aimed at healthcare professionals and education, there is some things that I think that are accessible to the general public. And that's why, because we try and pitch it at a really accessible level, because we understand the medium. People are listening to the podcast on their commute to work, when they're gardening, when they're walking the dog. So you want to keep it at a level that people feel they can follow and don't feel too overwhelmed by the knowledge of. So I think that's what makes it kind of accessible to a wide audience, because, we've got the benefit of having a look at how many episodes are downloaded and what is getting traction. And, we've got listeners actually in lots of countries across the world, not just Australia. So the UK and America and Canada and New Zealand and European countries is like that. So it's kind of interesting to see how it trickles out across the world.
Yeah, wow, that's so exciting for you guys. There's people listening all over the world. Very, very exciting. So well done. I think, I'd like to ask you now about how your work across different healthcare settings, it probably gives you quite a unique perspective, especially when it comes to deciding what type of topics you're going to be talking about on the podcast. And I can definitely hear your passion too for having information or education about healthcare in easy to understand language and making it accessible for people in whatever format. So depending on where they are, what they're doing, they can get that information easily. Why is that so important to you? I feel like that's something that's definitely come out in our conversations, and has there been maybe a particular moment in your life that made you really passionate about ensuring people can have that access to information easily?
I think it's probably tied to my personality, Christy. I'm the kind of person that if I found a cafe that's got really excellent coffee, I've got to share it with people. You've got to know about this cafe. It's really great. It's got great coffee, and I had a really delicious cake. So I think that that's probably where it comes from, as well as my personality type. So if I encounter someone in my professional network who's really knowledgeable about a topic, but not just knowledgeable, because I think there are lots of really smart people out there. What makes it that what I think is a different skill is, can they translate their smarts to another audience? And it's not easy to find those kinds of people. So I think I've been really lucky to work across lots of different hospitals and develop a network of people who I've encountered who, what is their passion topic? And when I encounter someone who's really, really knowledgeable about something, I'm like, hey, you explained that really well to me. Do you think that you'd be interested in doing a podcast on this particular topic, so that resource is available to lots of people? I remember when I worked at Sutherland Hospital, I did a lot of warfarin counselling again and again and again and again. And I kept thinking to myself, if only there was some video or audio that I could play to someone so that they got the basic understanding of what I was saying, and then I could come in at the end and direct them further. I think that would be a better use of time. So I think that's the philosophy of the podcast, is we don't try and put ourselves out there as exhausting every valid discussion point on a particular topic, but it's a starting point to give someone a basic understanding and a scaffold in which to develop knowledge and go for further avenues from there. So a lot of the times in our show notes, we'll link for additional resources for people to read. But hopefully after the 20 or 30 minutes that the person's had a listen, they know a little bit more than they did at the start and feel like they know where to go for their next steps. In terms of how we find guests, it's really like what myself and Natalie Tasker, who's my now current amazing podcast co-host, who do we work with? What are we encountering? So you'll see that there's a definite slant to infectious diseases in a very kind of concentrated period of the podcasts, and that's reflecting my history as the antimicrobial stewardship pharmacist for Western Sydney LHD. And that's because at the time I was interested in all things, and still am really interested in all things antimicrobials and infectious diseases. And when you encounter people like that, that's what you want to share the podcast with and that content for.
Yeah, absolutely. Totally agree. And sometimes finding guests can be difficult, but I feel that there's this whole network of amazing pharmacists out there that are maybe going under the radar.
100%.
And we need to get their knowledge. And so, maybe
and there are people who really underplay themselves. We had an amazing podcast with Carl Winkle on metformin, and one of our recent guests was Carl Winkle, who discussed metformin. And the commentary from Carl when we approached him was, who would want to hear from me? And he totally underplayed himself. And it was one of our most downloaded episodes ever because, people loved hearing from a pharmacist who was supremely knowledgeable and really passionate about a topic. And I think it's inspiring for people to hear that. And it's something that NIE is a goal for us for 2024, is to showcase more pharmacists, because you look back at previous podcast episodes and we do have a lot of medical practitioners and doctors, and I think it's because they are more well practiced in talking about particular topics, and it's a little bit harder to approach pharmacists, I think, sometimes. So I think that's definitely a goal for us moving forward. And sometimes it's about having a crack as well. So I read an article, and that was one of the inspirations for a recent podcast, and it was about deprescribing psychotropics and antidepressants, and that was from Dr. Mark Horowitz, and it was an ABC News article, and I just took a punt and emailed him from the email I found online, and he was more than happy to come and chat to us. So I think sometimes if you don't ask, then you don't get. So things that it's not just necessarily your network, but also reading articles and research papers from universities that are being shared on social media accounts is how we find a lot of content as well.
Okay, so looking ahead, what are your future aspirations for the Purple Pen podcast?
Looking ahead, I think Nye are just keen to continue on, really. I think that's something that's not an easy task, is putting out content on a consistent basis. I think, as I said earlier, it's really a goal of ours to showcase more pharmacists as our hosts, as our guests on the podcast. So moving forward, that's something that I think is important to us. And I think continuing to develop content that's relevant for our listeners. And I think hopefully by having more pharmacy guests, we can dive into more medication related topics rather than disease states so much, because that's been something that people have been really interested in. So some of our best performing episodes have been about de-prescribing psychotropics, metformin. We recently had a podcast with the wonderful Adam Lavori about cholesterol medications. And when you look at the stats, that's what the people want to hear. So I think that responding to what our metrics are telling us that people are enjoying and delivering more of that kind of content.
Thank you so much, Kristin, for being a guest on our show today. I really look forward to tuning into the Purple Pen podcast. So thank you again, Kristin, and to our listeners, thank you for tuning in.
Thanks so much.
You've been listening to Your Pharmacy Career podcast, brought to you by Ravens Recruitment. Don't miss our next episode, where we continue to explore the multifaceted world of pharmacy careers. Make sure to subscribe and share.